this is Layla. She's a student nurse. I'm going to be taking care of you today. Do you mind if she observes?
No, that's okay.
Okay, do you mind if I just take a look at your ID then?
Sure.
Your name and date of birth.
Andrea Johnson, 113080.
Okay, great. So Andrea, what brings you in today?
Actually, I haven't been feeling too well. I've been having very bad muscle cramps in my legs, and my stomach hurts, like, really bad. And I've been having really bad or difficulty breathing, and I don't know what's going on. Like, I never felt this way before. And it's like I'm confused. Like, I don't know exactly, perception of time or, what's going on. Like, I don't know. I just feel very out of it.
Okay. So how long have you been experiencing these symptoms?
About a week now or so.
Okay. All right. Well, let's take a look here at your chart. So it looks like you have a history of hypoparathyroidism.
Yeah, that's correct.
Okay, so with that condition, you actually have a risk of hypocalcemia. Now, do you know what it is?
Not really. It sounds like you're saying calcium.
Well, you're close. Hypocalcemia is when you have low calcium levels. Layla, do you remember what the normal calcium level is?
Well, I learned that the normal calcium levels should be, for an adult, they should be between 8.5 to 10.5 milligrams per deciliter.
So do you know what my calcium levels are?
Not yet. We're going to have to take some blood from you. And in addition to that, I should take an EKG. And do you know what we should look for in the EKG?
We could look for arrhythmias and also prolonged QT levels.
So having a low calcium can also affect how your heart beats. So you might not have a regular heartbeat. And any other lab work we should get?
The lab work should include checking her calcium levels, obviously, her phosphate, her TSH, her PTH levels, and also her vitamin D levels.
Okay, so I'll get that done now.
Yeah, we're gonna take your blood, and in the meantime, we should take your vital signs and listen to your breath sounds. And we can also see if there's some contraction of facial muscles as well.
Yeah, my smile is kind of tight.
Well, it could be from hypocalcemia. Okay, well, let's get those lab results. 1 hour later. Okay, we have your lab results.
Okay.
So you do have hypocalcemia.
What was my result? What was the level?
It was 7.3.
So the doctor did confirm that you do have hypocalcemia.
Okay.
Okay.
So what are some of the interventions that we can offer Andrea?
Well, we will continue to monitor your vital signs, your calcium levels, and your neurological state, because you did mention that you have some confusion. We'll administer, the doctor did order for us to administer vitamin D and a calcium antidote. And also what you can do is modify your diet, so you can eat more higher calcium foods, like dairy, or if you don't drink any dairy, you can also eat greens, leafy vegetables.
Okay.
Yeah. So, but we also want to continue monitoring you because you might get hypercalcemia, which is when you have too much calcium.
So right now I have too little calcium.
Yeah.
And I'm going to eat more to get higher calcium levels, and then I might get higher calcium levels that affect me.
Yeah, it might be from the drugs. So if you do have high calcium, then we have to stop all the drugs that you were just prescribed, and we want to continue monitoring your vital signs, checking your pulses, your breathing, just to make sure that you're at a nice level.
Okay.
But if you experience any weakness and any irritability still, then you're welcome to come back.
Okay, great.
Do you have any other questions?
No, that's it for now. I'll take your advice and increase my dairy intake and my green leafy vegetables, and let you know how I feel.
Okay, great.
Have a good day.
Good morning, Ms. Snowman. I'm Brian. I'm going to be your nurse for today.
Hello, I'm Carla, I'm a student nurse.
All right, Carla's going to begin by taking your vital signs, so you can do that. And I just wanted to ask you how you're feeling.
Not good, I'm so tired, my muscles still hurt, my heart still feels weird, vomiting.
Okay, so it sounds like you're having the same symptoms since you spoke with the last nurse.
Yeah.
Okay. So what are the vitals that you got from her?
So her blood pressure is 90/60 and her pulse rate is 120.
Okay, so these signs and symptoms are all conclusive in terms of you having hypokalemia, which means that your potassium levels in your blood are below the normal range, and the lab results did come back. You do have a 3.0, which is below the normal range, which is a 3.5 to a 5, so you're just under it. So the doctor did order potassium IV drip, which we're going to get started on you right now. Okay, so Carla, can you tell me any other possible interventions that we could do for Ms. Snowman with her hypokalemia?
So we can stop her Lasix and we can also encourage her to eat foods rich in potassium such as broccoli, avocados, dried fruits.
Okay, so that was for hypokalemia, that's what you have right now. But the thing is, you are going to be receiving an IV drip of potassium. So your potassium levels could go up, and it's possible that they go past the point of the normal range. So basically, if it happens that your symptoms that you're having don't change, or they don't go away, or they get worse, that could mean that you have hyperkalemia, which means that your potassium levels will go past the boundaries. So Carla, can you tell me what signs or symptoms that we would see if Ms. Snowman would go above the normal range of potassium?
So she would have increased blood pressure, also a decreased pulse rate, and we'd monitor your abdomen for distension.
Okay. So that would be what you would look for if your symptoms would get worse, or if we would find any differences in your vitals. So some possible interventions. Carla's going to just tell you, and we would take care of that if necessary. And what would that be, Carla?
So we would stop the potassium if you had too much potassium, and we'd also start diuretics. And we'd continue to monitor your abdomen for pain, for bowel movements, bowel sounds.
Okay. So that's pretty much it. So right now we're going to start you on the IV drip. If you have any questions or if your symptoms do get worse, make sure you contact us immediately. That is a cause for concern. But otherwise, we're going to start you on the IV drip and we're going to see how it goes, okay?
Thank you.
You're
Feel
welcome.
better.
Take care.
Hello, Mr. Goff.
Hello, how are you?
Hi, my name is Russell. I'm going to be a nurse today.
Hi, I'm Carla, I'm a student nurse.
Nice to meet you.
Nice to meet you too. Can you just tell me your name and date of birth?
My name is Brian Goff, and my date of birth is 5/1993.
Great. Thank you so much. So how are you feeling today?
Not too good. You know, I'm still dizzy, and I have been pretty nauseous recently, and I'm also pretty thirsty because they haven't been giving me anything to drink.
Right. We have been trying to restrict your fluids just as we continue to correct your electrolyte imbalance, but I am sorry for that. Any additional pain, discomfort, anything change?
Well, I have been having some pain here at the IV site recently,
How bad would you describe it? Scale of 1 to 10.
about 4.
So that is pretty common just when you have an IV in. I'm just going to inspect the site, make sure there's no redness, no irritation, so it should be fine, but pains to be expected.
Okay. Is there any other possible problems that can come up with me having the IV in?
So there are some common complications that may arise just from having an IV. Inflammation, infection, extravasation, infiltration. None of those should be a problem now as we've taken the proper precautions. We inserted the IV correctly, and your initial nurse did. We made sure to avoid any areas of flexion, hands, wrists, fingers, and we're going to continue to monitor the IV site just to make sure there's no changes.
Okay.
Anything else that we can do for you?
No, that's just about it. I guess I'll call you if I need anything.
Great. And Carla, did you get Mr. Goff's vitals?
Yes, his blood pressure was 90/60 and his pulse rate was 70.
Great, so it seems like it was right where it was before, so we're going to continue the IV therapy. Okay, if anything changes, give us a call.
All right, thank you guys. Appreciate it.
No problem.
Feel better.
Carla, and we're just going to run through the nurse's note. We're going to look for the next nurse. We're going to say Mr. Goff continues IV therapy of saline solution for his hyponatremia with no adverse effects noted. Mr. Goff appears alert person, place, and time, and reports continued nausea and dizziness, as well as a new pain, scale of 4 out of 10 at the IV site. Skin around the site shows no signs of inflammation. Fluids remain restricted, and we have his temperature is 98.5, pulse of 70, respiratory rate of 20, and his blood pressure of 90/70.
Thanks for teaching me how to do that.
No problem.